Well, good afternoon, and thank you to everyone to tune in virtually today. I certainly prefer being in person. We will hear from two of my constituents, Sue and Steve, who will be directly impacted by this manufactured Republican healthcare crisis. Right now, millions of Americans, including 16,000 folks in my district alone, benefit from the Affordable Care Act's enhanced premium tax credits. These tax credits help lower the cost of premiums and allow millions of people across the United States to afford care they may otherwise not be able to get. However, these tax credits are set to expire at the end of this year. And right now, folks are starting to see the impact of those expiring tax credits. And if that happens, millions will be forced to choose between shouldering higher costs or potentially going without care. And that is the fight at the heart of this government shutdown right now. Democrats, like myself, want to extend the credits and avoid this crisis. But Donald Trump and congressional Republicans are refusing to work with Democrats, preferring instead to shut down the government, increase costs, and rip away healthcare from millions. Right now, I am in Washington, D.C. I'm ready. I keep saying this to my colleagues across the country. I'm ready to get back to work. I want to lower costs for Oregonians. And my Republican colleagues have been on an extended vacation, avoiding this crisis that they created. Republicans control the House, the Senate, and the White House. And this government shutdown is on them. And they have the power to ensure millions of Americans in every corner of our country do not have to pay upwards of double the amount they're paying right now for premiums next year. But unlike my Republican colleagues, my constituents, Steve and Sue, don't have the luxury to run and hide when things get difficult. And they're just two of the over 16,000 Oregonians in my district who may have to decide whether to foot the Republicans' bill, this higher tax on healthcare, or to go without healthcare coverage altogether. A choice no one should have to make. And let's also not forget this crisis, in addition to the Republicans' massive cuts to Medicaid under H.R. 1, which were the largest cuts ever to Medicaid in US history, all to give tax breaks to billionaires. This is a betrayal of Americans everywhere. Because when everyone can access affordable quality care, we all benefit. We do not want to take people out of the healthcare pool, especially those who are relatively healthy. It makes the healthcare system more expensive for all of us. My Republican colleagues must come back to work to protect these tax credits and reopen the government. Like I said, I'm here, I'm waiting, I'm ready to negotiate. But they have to come back so people like Steve and Sue can lead comfortable, affordable lives and know that they can access the health care that they need when they need it. And so now I want to turn it over to Sue Monahan from Salem. Welcome, Sue.
So thank you, and thank you for organizing this. So I'm Sue Monahan, and I just want to share how my health insurance premiums are about to go up. So a couple of years ago, I retired from my role as an administrator at Western Oregon University, and in 3 years, I will be Medicare eligible. Right now, I buy my health insurance with after-tax dollars through the ACA marketplace in Oregon. It's a bronze plan, it's HSA eligible, and it has a $7,100 deductible. I researched this extensively. This is the least expensive, most cost-effective plan for me. So next year, if the enhanced subsidies expire, my premiums will increase from $439 a month to $1,059 a month. This is for a plan where my all-in is over $19,000 before I see any care paid for beyond a mammogram and maybe a flu shot. So why is health insurance so important to me? Well, a few years ago, I was a kidney donor, and a lot of things came together that allowed me to do that. Not least was the ACA and its assurance that I could have access to affordable health insurance until Medicare kicks in. I was healthy then, I am healthy now. But with that real sort of rest of my life potential complication, I cannot let health insurance lapse. So I will pay the $1,059 a month. But I know there are a lot of people who can't. And if they don't get signed up during this open enrollment period, if it's just too expensive, then they're going to be locked out of good and decent health insurance for the whole year. That's why it's so important that we resolve this now. It breaks my heart that Republicans in Washington have chosen to play chicken with the lives of people who may otherwise lack access to affordable health insurance. Thank you for hearing me.
Thank you, Sue. So, Steve, before we go on to you, I just want to just follow up on a few things that you mentioned, Sue. So, you shared that you are a kidney donor, and part of why you were able to be generous and donate a kidney is that you had affordable ACA health insurance. If at the time that you made the decision to become a donor and had to pay what you were expecting to have to pay when these tax credits may end, um, would you think about becoming a donor today?
So donating a kidney is a complicated decision with those financial and health risks. I actually had employer-based insurance when I donated, but I knew that should my employment end, I had that safety net of the ACA's affordable health insurance to fall back on. And I've really given a lot of thought to this, and I like to think that I would have donated a kidney anyway, even given the risks, but I'm not sure I even would have reached out to the transplant center
Mm.
if I hadn't known that my health care was taken care of. And I think that, I worry about this because, there are 90,000 people waiting for a kidney. And any policy snafus that block donors just make it harder for those people to become healthy again.
That's right. And this is an area until we encountered each other. It was something I hadn't even thought of. My maternal grandfather actually died of end-stage renal disease, and there wasn't anyone in my family, I was pretty young at the time, that really was a good match for him. And to your point, there aren't enough kidney donors. So thank you for your selflessness. So without the tax credits, your premium will nearly triple. And with the 3 years until you're eligible for Medicare, the increase in cost between your premium and deductible will be about $43,000 until you're age 65. Um, 43, let me just repeat that. $43,000. We just did, the math. So between your deductible increase and your premium increase over the next 3 years, what would socking away that $43,000 mean for you and your family leading up to your retirement?
So I think that there are a lot of people like me who don't have pensions who worry about running out of money before we die. And I hope I have many years left, but that means many years that I have to support myself primarily, largely with what I saved during my working years. And hits like this mean my savings aren't going to go as far. As I said, I am going to find a way. I will have health insurance. I will find a way. But for me and a lot of people, I think it's important to understand that the end of enhanced subsidies has implications not just for next year, but for the rest of our lives.
That's right. And there are so many people out there just like you, and whether it's, somebody who has been through a transplant, somebody who may, people even whose cancer is in remission, they still need to make sure that they have health care, or somebody who has chronic conditions, heart disease, diabetes. You need health care. You can't go without it. It's life-saving, right? So it's thank you for that. So next up, why don't we go ahead and hear from Steve from Beaverton?
Good afternoon, everyone, and thank you to Congresswoman Salinas for the chance to talk about how rising healthcare costs will impact my family. My name is Steve Coppis, and I live in Beaverton with my wife, Aria. I'm 68 years old and fortunate to be on Medicare, but Aria won't qualify for a few more years. Aria works as a cook at our local Thai restaurant with her sister and brother-in-law. It's a family-owned operation with a small staff that works very hard to serve the community. Like many small businesses across the country, the restaurant can't afford employer-sponsored health care. But thanks to the Affordable Care Act, we've been able to afford Aria's health care through the marketplace. Having health insurance lets her access care like routine doctor's appointments, prescriptions, and preventive screenings. And most importantly, it offers us peace of mind. We know that if something unexpected happens, we won't lose everything. Unfortunately, that peace of mind could disappear. We currently pay roughly $550 a month for Aria's premiums, but if the enhanced premium tax credits expire, her premium will go up to more than $800 per month. That's an extra $300 per month or $3,600 per year, and that puts a massive financial burden on our family. And now, if Republicans in Congress don't extend the enhanced premium tax credits, we will probably not re-enroll Aria in her health care plan next year. So unless something changes, my wife is likely to lose her health care because it's simply too expensive.
Thank you, Steve. Um, this is another heartbreaking story of what this all means for families in my district. So Steve, you shared that your wife gets her healthcare coverage through the ACA, and because of the enhanced premium tax credits, you've been roughly paying about $500, but it sounds like it's going to go up by over 50%. But how much peace of mind has this coverage given you and your wife and your family? And what impact does it have to think about maybe foregoing this coverage while she waits to age into Medicare?
Well, all of us hope that there's no catastrophic accident or illness that costs hundreds of thousands of dollars in healthcare. But with this coverage, we don't have to worry about that. We know that after 10,000 or 20,000 or whatever it is, I don't remember the figure, that we're going to be mostly covered. Without that coverage, it's a crapshoot. If we're lucky, nothing will happen. But if the worst happens, then it's going to be a disaster.
So have you and your wife started thinking about, worst case and any kind of worst case scenario planning or any potential healthcare needs that she might have over the next few years before she gets to Medicare age eligibility?
Well, yes. I mean, she hasn't had health insurance. She immigrated from Thailand, and she's a green card holder. But so she got her first mammogram last year, and she needed a biopsy. Unfortunately, it was negative.
Oh.
But she's never had a colonoscopy. I've had three. You need those. I know somebody's. I'm a freelance writer. One of my main clients, her husband has terminal colon cancer, so it's really important to take care of these things. And so, the earliest we can get Aria in to see, a specialist is just for the initial consult is January. And so, I'm not sure, if we're going to have to pay for that out of pocket. I'm thinking, well, if we don't pay, you know, thousands of dollars to an insurance company, we can, save that for out-of-pocket medical expenses. Maybe we'll still come out ahead if we're lucky, right?
You've used that term lucky a couple of times. It does, I'm sure, feel like you're rolling the dice,
Yeah, I
right?
don't like to play. I don't like to gamble.
Right. You just don't know.
Healthcare.
Yeah, that's right. Oh, and this is not, again, this just goes back to nobody should be put in this position of gambling with their lives and their own health care. Um, okay, so one last question. So with the ability to, to have healthcare and your wife's ability to have healthcare, what does that mean? Like just kind of for family morale while, they're able to have a small business running and feed the community in Tigard. Having that safety net, what does that feel like for you and your family?
Well, I think that's huge. I mean, when Aria first came to this country, she followed her sister and brother-in-law, uh, and they're U.S. citizens now. But they had to take care of her a lot, and they got the COVID vaccinations and that sort of thing, that the restaurant paid for. And if there was some dental problem or something that came up, they would take care of it. But there was no routine care, until we got married and we got her on a health insurance plan. So it's huge. I'm sure. I mean, I haven't talked about it with my in-laws, but I'm sure they're very grateful that they can take that off their plate because they have enough other things to worry about.
That's right. And I think both Sue and Steve are kind of getting at there's a lot of choices and a lot of pressure on families, right? It's that psychological, like, what else am I juggling here? What else do I have to think about, right? Is it food? Is it housing? Is it my health care? There's a lot, and costs continue to go up, and people are having to make really hard choices. So I just want to close by first of all thanking both of you for sharing these stories. It's rough times, and sharing stories like this is meaningful because you're not alone. I have to reiterate that you are just two of over 16,000 people in my district who are having to make similar decisions right now. And I'm glad you saw your notices and you started thinking about this earlier than some. Your stories are deeply personal, but sadly, the themes are far too common. Families should not have to choose between paying bills or paying for healthcare. And these stories are heartbreaking, but they are entirely preventable. I hope everyone joining us today is able to share these stories to highlight the real impact of this manufactured healthcare crisis. And the simple solution we have, if Republicans would just come back and do their job, is sitting right in front of us. We could extend these tax credits and bring relief to families, millions of families and individuals across the country, and especially the ones right here in Oregon. So again, thank you, and I'm happy to open it up to questions from the press.